The following exercises target the serratus anterior muscle. The serratus anterior originates on the anterior border of the scapula and inserts on the anterior surfaces of the first 8 or 9 ribs depending on the individual. Based on its origin and insertion, the serratus anterior has a line of pull that moves the scapula anteriorly and laterally, allowing the scapula to protract and upwardly rotate. Protraction of the scapula is needed for pushing or punching type activities. The lower fibers of the serratus anterior act in a force couple to upwardly rotate the scapula. Upward rotation of the scapula is necessary to allow for scapulohumeral rhythm and allows for 180 degrees of glenohumeral abduction. The serratus anterior also stabilizes the scapula on the thorax during these motions. The following exercise to strengthen serratus anterior is called a serratus punch and involves a concentric contraction in an open chain, non-weight-bearing position. For the serratus punch, the patient will be positioned in a supine position. The patient will flex the shoulder to 90 degrees with an extended elbow. To begin the exercise, the patient will punch their arm in the air through scapular protraction and then bring the arm back towards the plinth through eccentric protraction. The punch should be performed at a steady and controlled pace. The serratus punch in this position is of moderate difficulty because the motion is only resisted by gravity. For patients who find this exercise too difficult, the patient can begin the exercise in a seated position. The patient will once again flex the shoulder to 90 degrees with the elbow extended. The patient will punch straight forward through scapular protraction and then bring their arm to the starting position through scapular retraction. Performing the serratus punch in this position eliminates the force of gravity that the patient must overcome to perform the punch. Therefore, this exercise is less difficult to complete. For patients who need a greater challenge, this exercise can be performed in a standing position with the addition of a TheraBand. The patient will stand with feet shoulder-width apart and good posture. One end of the TheraBand will be affixed to a stable structure, and the patient will hold the other end of the TheraBand in the arm that will be completing the exercise. The patient will flex the shoulder to 90 degrees with an extended elbow and punch forward in a steady, controlled manner. This exercise is of increased difficulty as it includes added resistance. TheraBands of different colors can also be used to progressively increase this exercise. Physical therapists should be aware of fatigue and substitution with this exercise. The patient may flex and extend the elbow, or rotate the body when they become fatigued instead of initiating proper scapular protraction and retraction.
The following exercise to strengthen the serratus anterior is called a push-up plus and involves a concentric contraction in a closed chain weight-bearing position. To begin the exercise, the patient will lean against a table with their arms extended and feet shoulder-width apart. The patient will lower their body closer to the table while keeping their arms extended through eccentric contraction. The patient will then raise their body back to a normal position, protracting the scapula. This should be performed at a steady and controlled pace. Performing the push-up plus in this position represents a movement against a partial force of gravity. For patients who find this exercise too difficult to complete, it can be completed against a wall. For this version, the patient will stand upright with their feet shoulder-width apart in front of a wall. Performing the push-up plus against a wall represents reduced difficulty as it eliminates the force of gravity that the patient must overcome to perform the exercise. For patients who need a greater challenge, this exercise can also be performed in a traditional push-up position with 1 or 2 arms. Instead of completing a traditional push-up by bending the elbows, the patient will lower their body towards the floor while keeping their elbows extended. The patient will then raise their body back to the starting position. This exercise is of increased difficulty as it is performed in a full gravity position with the added resistance of body weight. Physical therapists should be aware of fatigue and substitution with this exercise also. The patient may flex and extend the elbows when they become fatigued instead of keeping the elbows extended and locked.